Here we start by shaving the patient, and then we scrub them with alcohol swabs, and then Mommy Audrey here does a nice chlorhexidine scrub down, 4% chlorhexidine scrub down with Iricept. We scrub in the balls with the bristles. It's really good. You get a good nice lather, and then we dry them off with these paper towels, and then we use the ChloraPrep. So we're gonna scrub this man ready for his implant. Try to decrease the bacterial load. We have them use the HiPACleanse the night before, from the neck down, and then we have them shower with it even after surgery, once they can be cleared to shower 3 days after surgery. So here we're prepping with the ChloraPrep, and we massage the incision area for 30 seconds. 14. So we measure by hitting the bone here, pressing a bone press strike, and we look at the penis here, and we see the glans tip ends at 14 centimeters. So we know usually 14 plus 10, or 9 in this case, is what it's going to be. So we have to make sure we tell our Coloplast reps to have the correct implants in the room. Right? Usually we mark at the base right there, a 3/4 inch incision, and we mark right here in the bottom of his ball sack an X for the pump. Perfect. We find midline so we never get lost. Nobody wants a pump on one nut or the other. That's good. And then we'll take a timeout. We're using Exparel. We save the last 2 cc's on the top side here for the inguinal hernia area. That way, inguinal area. Okay, I'll take a 15 blade. Okay, so we're gonna get started here. Gonna make our 3/4 inch cut nice and small. We're gonna take the bovie, and we're gonna start going lateral here. Lateral, so away from the nerves. All right, artificial erection.
Artificial erection, no marshing.
No marshing. All right, we're gonna kind of push this down. We're gonna kind of take a look at the penis now. Try to fill it out, fill it out, fill it out. Look for any curvature. We're gonna start by opening the erectile body, okay? You can see Audrey's got everything kind of held in place right here. So we're gonna open up the erectile body. It's kind of thickened. Yep. And then we're gonna repeat this process on the other side. We're gonna look for any urethral injuries here. Okay, we're gonna take a look. So we don't see any urethral injuries. He looks pretty decently straight. There's the ivory white corporal on the other side. We're placing in our medial stitch. Here we go. Dilating proximally. Okay. Go with Mommy Audrey. Yeah, but now there's a hole. Yep, it's closed now. Okay, Ioban. Okay, go ahead. We're gonna put the Ioban down right over the incision. So you see how Audrey did that nice overlap? Pull the penis on the strap. You see how she got that overlap there? So it saves us from doing more Ioban vertically, right? So that's a nicely placed Ioban. Well done, Audrey. Beautiful. So now we know our medial stitches are straight. We know our lateral stitches are curved. This allows us to quickly untangle everything and get organized. In seconds, we can figure it all out. So when you're back on. All right, go, go, go. Up and out, up and out, up and out, all the way down. Okay. Hold the strings. I got it. Get them both. Grab them both. Okay, thank you. Sorry, I'm just making sure our back end is good here. That sits like that. How does it sit? Okay. Hold. Thank you. Okay. That's it, we're in. Okay, we're going to do a test inflation now. Okay. We start off at 45 or 50 cc, 45 or 40 cc's. Pull your strings up, hold them up.
I got it. I'll do 50 on just each of them and then is those working or it's not my setup?
Okay, let's measure him.
I don't care.
So now we're inflated all the way. We're max inflated. And he looks pretty good. Slight upwards curve. It's got a good looking result here. And we got a 14 to start and 14 to end with, so we're good to go there. Slight curve, it's a slight curve. We're gonna leave it alone. It's for her pleasure. So now we start by grabbing the strings, going to the back of the wall, hit the pubic bone, turn our hands downwards and aim slightly left of midline, and it'll come right to the middle of midline. See that little trick we just showed you guys? Nice little trick there. Take the tonsil ring clamp and open this up, get the drain. Put the drain down first. So we're gonna grab the drain, put it down, and then we're gonna put the pump down with a button facing frontwards if we can. And we're gonna pass the pump to Audrey. The incision's so small, we're having trouble getting it down.
Button's facing up right at this moment.
Okay. So we're gonna put the drain in. Remember we marked them right here so we can see our mark through the aisle band. And he may take the drain out, so it may be us or him, so I don't know. We don't know. So just act like he's taking it out, even though he said he wanted us to.
Steri strips when you give me all the ducking, please.
And you pull this into view so you can just see the white tubing. Mommy Audrey's gonna give us an inch. Pump looks good.
Where it needs to be.
Yep, it's good. So give us an inch, pull.
Rub shot.
So she's gonna do one click now instead of the 3. Now this one we gotta pull a little gentle on because he's submuscular. Pull that down. We're gonna cut this.
T3.
We're suturing the drain in and we're connecting up the quick connects at the same time to save time.
Monochromic T3.
And then we're gonna cycle it and we're gonna close them up. So Mommy Audrey here is gonna use her clip. See it? Clipping the two ends together.
Bag of thing that wasn't in there.
So right now the pump is front to back. You can see the drain sitting there. Audrey's gonna cut the strings. Not bad response there. Nice full erection. So we checked it twice. We're gonna hit the deflate button for him. We're gonna irrigate him once and close him up. So we're gonna pour some vancomycin powder into the wound. Okay. We're gonna get a Stratifix. And then we're gonna grab the fascia here. And then we're going to use the Viagenics graft here to kind of assist with wound healing. So we're going to kind of lay it down into the wound here.
Thanks, burrito.
There. We'll pull his pump down, put his drain on suction. We go from there. He looks amazing. Good job.